Now we have another session which is going to also touch on some of the digital transformation ingredients. And it's my great pleasure now to welcome a new moderator to the stage, Klaus Bernke from the partner LEK Consulting for a great session on digital transformation. Klaus, over to you.
Thank you. Can you all hear me okay? Is the volume fine? If I could please ask all my fellow two in-person panelists with me, Giuseppe and Petri, to join me, and then hopefully we'll have the panelists join. Fantastic. Davide and Daniel looking over my shoulder here, which is great. So thank you very much. We'll be talking about the future of primary care and what it looks like. Thank you so much for joining the panel. I think I'll let you introduce yourselves in just a minute. Do quick scene setting first about the topic. And then I think it will be super interesting to hear your viewpoints because you're all coming from slightly different angles. I think from, sort of the pharmacy side to the full AI side to the kind of diagnostic side and from the integrated health system side. So I really look forward to hearing all your views. So with that, let me quickly do some scene setting here. Do I get, perfect, fantastic. Great, so what are we talking about when we talk about, the future of primary care? And to me, when you look at the continuum of care, right, it goes all the way through wellness, healthy individuals that want to keep healthy as long as possible, through then something goes wrong, you have triage and screening, diagnosis and treatment, disease management, when people are released from secondary, tertiary care, and then obviously the monitoring and elderly care. So all this continuum of care is now becoming, becoming more digital and therefore more accessible. It's easier to access physicians and to connect patients and medical professionals. And of course, you have different funding arrangements as well in the different countries. And you have different technology that's being deployed. So I just wanted to set the scene there that what we're going to be talking about are really those things in bold that kind of, make it that is accessible in a digital format, right? And by digital, I mean everything from a phone call to a video call session to mobile app to a digital therapeutic, anything that's really digitally easily accessible for patients to be able to access the healthcare system. And so what we've seen is the emergence of companies that are specifically focused on this, like the telemedicine providers and digital therapeutics providers, but we're also seeing the established institutions fighting back and doing a lot of these digital things, and oftentimes just as well as the digital startups are doing. So that'll be a good discussion we can talk about today. And in addition to these easy ways of communicating, we also now increasingly have, the convenience of being able to do things in the comfort of our home that go beyond just communicating, right? Beyond just talking to a medical professional, getting perhaps a diagnostic assessment. Now we can actually begin to do testing at home, right? And the testing can be, with the typical molecular serological testing that we do, or it can be digital in the future, right? With wearables and smartphones. So what is possible at a distance and what is possible in primary care keeps increasing all the time. And as computing power advances exponentially, we as humans are not very good at grasping exponential change. We're a bit better now with COVID because people see that for a long time nothing happens and then all of a sudden quite a lot happens. But the digital technology will become ever more powerful in the future. And then finally, in terms of the scene setting, right, we can see these emergence of platforms, and this is just by way of example, a US one here with Walgreens Find Care. You can find similar platforms in Europe with Zorosa, for example, or in China with Ping An Good Doctors and others, where companies are seeing that they cannot actually do everything themselves, but they want to create a really good patient experience. And so you begin to kind of, bring together the e-commerce and pharmacy element, the GP element in terms of telemedicine, the digital therapeutics, and all these other elements, including, sort of more robust hospital services that you need to access in person. So it'll be interesting to see how these ecosystem play actually also develop in Europe. So having said this and set the scene a little bit, I don't know how to make this go away actually. So if we can just remove the presentation. Technology team, perfect, thank you very much. With that, I'd love to, begin the discussion today. And maybe, just initially, I'd like to ask you to briefly introduce yourselves. We got some really great people on this panel, CEOs, founders, medical officers. Introduce yourselves a little bit and talk a bit about the company also, where you have a leadership position, and what you're currently doing, right, in terms of primary care. So we can all understand a little bit where you're coming from and your perspective. Maybe Giuseppe, you want to go first, then Petri, then Daniel and Davide, in that order. Just make sure that you guys are all following us here. I don't know where the camera is or where you can see me. I'm turning around to see you, but yeah.
Okay. So good afternoon,
we can
everyone.
See you.
I'm Giuseppe Recchi, I'm CEO of Affidea. Affidea is today what we believe is the largest provider of polydiagnostic services. We operate by running centers which are founded over digital imaging equipment, principally, and they offer multi-specialty diagnostic, adapting to local business model in the countries where we operate. We run about 308 centers in 15 countries, and the team is made by 9,000 people between again, internal FTEs and medical personnel, which is contracted. The story of the company is a typical buy and build and organic growth. It was started in 1991, and through the years he built a legacy of being capable of standardizing at best the quality of the output to patient and the efficiencies of managing such a large fleet of equipment. We run about 1,400 pieces of equipment that goes from MRI, CT scanner, PET-CTs, LINAC, mammo, and so forth. So we are probably the size of some countries in terms of equipment fleet that we run. The way we look at the market is basically by offering patients the first contact for specialty visits and diagnostic, which is actually an increasing demand, especially after COVID, given that the big hospitals are perceived more and more as a hub, which is not, I would say, which is complicated, especially if you don't need intensive treatment or critical care. If you want easy access and find specialty visits, you want to go to either private because the waiting list is too long, or private and public combination in a place which has a better proximity to you, is easy access, and is specialized. So specialization today has become the way to go, and we can touch how digital will help us doing that.
Thank you. Petri?
Good afternoon, everyone. My name is Petri Bonan. I'm the Chief Medical Officer at Terveystalo Finland. By basic training, I'm a medical oncologist, and that's probably the reason why I'm also a huge fan of value-based healthcare. About the company, so Terveystalo is a publicly listed company. It's Finland's largest healthcare provider, and we provide comprehensive primary care and also specialist care for private person and of course for companies, and also we provide our services to public sector in Finland. After acquisition of Feelgood in Sweden this summer, so Terveystalo has actually become the largest occupational healthcare provider in the whole Europe. We have about 13,000 professionals working for us. This number also includes private practitioners, and we operate in more than 300 different locations. Last year, in 2020, we had 6.9 million appointments, and out of these, 26% were performed remotely, and this makes 1.8 million remote visits. And what comes to numbers this year, so we can still see very strong growth in the remote visits, also in the first parts of 2021.
Perfect.
Finally, GPs. We have about 2,000 GPs working for us.
Super. Thank you so much. Daniel?
Yes, hi. I'm Daniel, co-founder and CEO of Ada Health. Ada is a digital health company headquartered in Berlin. We've been around for 10 years. And the way Ada works really is as if you could have a WhatsApp chat with your trusted family doctor. It's based on artificial intelligence. Our app has been downloaded over 11 million times. We have 25 million cases in the system. Over the last few years since we launched our app, it has become the #1 medical app in 140 countries. It's now available in 11 languages, not yet in Finnish, sorry, but we could work on that. We don't only have the consumer app that you can freely download from the iOS App Store and Google Play Store, but we also work with leading health systems, for instance, in the US, with global health insurers as well as with governments, providing them a digital front door to their service for their own patients.
Thank you.
Good afternoon, everyone. Davide Tavagnello, I'm the founder and CEO of Hippocrates Holding. Hippocrates Holding is the largest independent chain of pharmacies in Italy, which I personally founded the company 3 years ago. That was in March 2018. We basically had 0 pharmacy at that time. So the story is a buy and build story. We raised the capital to become the leading independent chain in the country. We've been able to do that over the last 3 years. As of today, we have 240 pharmacies in our portfolio, still growing approximately 10 pharmacy a month. Within the group, we also own a company which is called Ita Salute, which provides services to GPs. In a way, the model that we are implementing is probably a model which is already well known in other countries, such as, for example, the US. I'm sure you are familiar probably with the Village Medical Walgreens model, where you have primary care next to the pharmacies. In this specific case, due to regulatory constraint, we cannot operate GPs offices. So what we do is we just provide services to the GPs, which clearly have their GPS clinics next to our pharmacies. But in doing that, we sort of manage 66 clinics, and we are in contact on a daily basis with north of 200 GPs. That is the story around Hippocrates. So it's a pleasure to join you and to be part of this panel.
Perfect, thank you. So that gives us a good introduction, a good overview of very different, I think, panelists that we have here covering different geographies from global to Europe, and also coming from different angles and attacking this digital healthcare space. I'd like to focus on, with my next question, a little bit on these different components of digital healthcare, right? And typically, I tend to think of it that there's some sort of digital access channel often, right? So there's an app. In the case of Ada, there might be a phone call. In the case of Terveystalo, or a booking of an appointment. In the case of Afidea, or a pharmacy visit. So there's some sort of access channel that increasingly we see migrating to the digital world, right? Especially during COVID, we saw that dramatically change. So we have an access channel component, chat, voice, video, We have a care component, which obviously then involves some form of diagnosis, which in Ada's case is handled with AI, and your case might be handled with a GP on the phone. And so that's handled again by a different component. And maybe we just begin by talking initially about those, maybe beginning again with Afidea. How do you see your touch point, people then entering this kind of diagnostic contact with you, today, or how that might evolve in the future?
So if the question is how digitization is impacting us is multiple ways in our business. Of course, that has increased thanks to COVID because the relationship with the patient has to be reinvented. But it's multiple avenues. I mean, we're talking about big data, which was always there. We treat about 8 million patients a year. We produce about 14 million scans. And so this data is a huge data lake that is available for multi-purposes and values. But the problem here is how the privacy compliance matters allow the use of this data. So being an international platform is very difficult still now to exchange data across countries. Telemedicine is one factor which is increasing. To us, it's still not clear how much telemedicine is bringing value in the red box. So far, we see it more as a marketing tool, something that you cannot miss to have in order to access your customer. We have budgeted some again, extra gains coming from that, but it's more for marketing that direct P&L making. The biggest thing of change is the patient access to the company. So how you go through the social media, how you build these portals where patient can own their data and interact with us. The faster you can do it, the better. Of course, the challenge for us is doing it in 15 countries, in 15 languages, 15 type of modalities, and backing this up with the IT infrastructure. So this is pulling behind a lot of capex for IT, especially in our industry, because having the images is particularly heavy. And then we have other streams like teleradiology. Teleradiology is a way how we exchange data across centers. This is meant to create efficiencies to cope with the scarcity of radiologists, so try to have the human factor at best played, but again, still the IT and compliance of moving data is one factor. And second, most of these things are highly spoken as disruptor at the macro level, but then at micro level. So for company impact, we need to, I mean, we're not venture capitalists, we're not building for future value on reselling on the market or IPOing. We need to produce EBITDA and give this sense in the industrial P&L of the company. So teleradiology market for now is forecasted to be less than 1 billion in 2026. There is no real market except the Anglo-Saxon speaking market where this has picked up. And so we're waiting for the market to cope with it. And last and not least is AI, same story. A lot of discussion on AI, a lot of value. We are experimenting about 6 AI. We're choosing in 4 countries as a pilot. Out of this, just one is creating huge box advantage because it allows us to, in PET-CT, to reduce the RSG usage. And so this is a real cost efficiency and a patient benefit for the cycle time. But so it's a vast universe of touches of the digital impact into our business.
Thank you. Can you give us a bit of an example of how you're using telemedicine at the moment?
Telemedicine is a development stage so far. So we're talking with a lot of specialist provider. What we say is that having the asset base already built with a network of patients, which most of the countries make us market leaders in our particular space, they become a natural enhancer of the contact with the patient. So we need to connect, of course, GPs where GPs are important with customer for first access. So we look at really, as I said, as a marketing tool, such to create fidelity of customers, such to create a prime access, rather than really offering a dedicated doctor interaction. So it's more for the first touch, such to drive then the patient to the deeper visit and interaction with the doctor and the scanning that he needs for diagnosis.
And then would it be like before the diagnosis to be able to talk to someone to understand what will be happening during the diagnostic process, and as a follow-up to be able to talk to a radiologist, for example?
Exactly, because the model of a polydiagnostic like we are, which I think is kind of unique in the healthcare space, allows that to be maximized. Because we see our, again, competition in the healthcare service being either the big hospital, which are, again, great providers. They're particularly and hub because they're concentrated is in a location, unless they have developed, again, multi-presence, but usually I see them as a big hub. Or specialists around what we call verticals of services, like, again, dentistry or ophthalmologists or MSKs or cardiology. I think the polydiagnostic is going to become the spoke of the big hub of hospital, which might be leading in a particular region, but I don't see a patient willing to drive 1 hour to go to as much as good it is as quality as a big hospital, if it can find as much as good as possible or quality in a proximity with as much as good offering of doctor specialists. So being a brand with such, I would say, a reputation in the radiology space allows us to be not just attractive to patients, but mostly for doctors, which today I think is the winning factor. So this specialist expertise, if they're presented through a telemedicine platform, they really allow you to collect the multi-species of demand of the early diagnosis healthcare industry and the and needs.
Thank you. So I guess, Petri, with more than 1 million teleconsultations, presumably they've been somewhat profitable for you?
Yeah,
coming back.
And actually, they were not telephone consultations. Most of them were through digital visits. And actually, I'm a little bit challenged that it's not just a marketing tool, this telemedicine. And at least if we talk about GP world, and I think that probably 50 to 60% of all appointments to GPs can be performed remotely in future. We did 26% in 2020, and their growth will continue. But then when we talk about different channels, so I think it's important that we use also the correct terms. WHO has established a pretty good guideline for digital health, and it includes all terms, including telemedicine, digital health, mobile health, e-health, and we should be pretty careful when we talk about these different ways and channels. But for sure, I'm a strong believer that telemedicine will grow still, and it's not that everything can be done there. It's winner will be here a hybrid model, so that you start your consultation probably remotely. Then sometimes it's just via chat for some very simple symptoms like some urinary tract infections or eye infections. You get immediately their prescription. But it may also be that the GP then continues and prescribes some lab tests and imaging, and then you come to a physical visit. That may be with a GP or it may be with a specialist. And it's important that we can use telemedicine not just as a way for the client to reach us, but also we as providers, our GPs can consult what telemedicine, also specialists. That's important. Then also education for our specialists that can be used, and maybe not that much in a GP world, but for example surgeons. If we see a couple of years ahead, so probably a lot of their training will be with digital tools and not anymore just training with patients. And then very important is also that with telemedicine, we can track our patients, how they're doing. They can submit their data, and then with the use of AI, we can get some practical information to the professional, to the dashboard also. And that's where we then use and will use more AI in the future. And if you talk about AI, so already now, so we know that how physicians follow current guidelines, so there's a lot to improve. For example, patients with back pain, so maybe 25-35% of them receive the physiotherapy required according to the standard guidelines. It used to be just imaging, pain medication, and rest. but nowadays it's something else. And what has happened actually during the COVID is that now we can provide also these exercises via these new channels to our patients, so that they don't need to come over to the appointment room to see the physiotherapist, so that they can do it at home and then have a remote visit together, either with the doctor or with another professional. So these are my first thoughts about where to go. And then if we have a look at our own data, that where the growth was highest last year and still continues, it is video appointments. So video appointments, actually, we had a 50-fold increase last year in those. We also had maybe 5-7 times more chat appointments, but these video appointments are very important for the clinician. It provides a lot more than just the chat platform. And then as newest tool, we also have had maybe 2 years already, is in our armamentarium, is that an assisted video appointment means that if we don't have enough physicians go in to meet the patient, so a nurse can together be with the patient, and for example, a physician can remotely examine ears, mouth, nose, heart, lung, and I personally done the with the stethoscope when it's amplified through the USB, and I can guarantee that actually it's a lot better than a standard old-fashioned stethoscope. So it's really cool to do that assisted
with the patient
appointments.
and the doctor is the GP is remote.
Yeah, exactly.
Right. Okay. And yes, and you mentioned GPs quite a bit at the beginning, but then you also talked about specialists. So are specialist appointments also moving to the digital world with Terveystalo? So is it, and which specialists are the ones that work best over a distance?
Let's start with mental health. That's already there. It's been for a couple of years already. So it's not just psychiatrists, but it's also other mental health professionals. So they are certainly, a lot of their activities is happening remotely at the moment. But then we also see some new areas like orthopedics. So you can start the examination or with the remote appointment. Then after the scans, then the orthopedic makes the treatment decision. And that may include that then there comes an operation, but after the operation, the recovery phase. So that's again pretty much remotely, and that's something actually we also perform already now.
Right. Okay.
But of course, not every orthopedic in our company is already doing that. But that's the direction we certainly want to move to.
Yeah. Thank you. Great. So if we move on to Daniel from ADA. We had a lot of discussion around diagnostic centers, obviously people-based and GPs and specialists, but ADA, as you just mentioned, you have 24 million cases in the system, which did not actually, talk to a person, right? So I guess the question is, there's never enough medical professionals globally available. Daniel, where do you see this road going in the future when you include more data from diagnostics, from wearables? What is the potential of this AI? Where can it go?
Yeah, thank you. So I guess our vision for the future is possibly a bit more radical in terms of putting the patient more at the center of it all. We think that with all these new omics, with the ability to measure via your smartwatch or other sensors, you can measure, you can do an ECG, you can measure blood pressure, you now have continuous glucose monitoring. All of these things at the same time, we've seen through COVID that direct-to-consumer diagnostic testing is also growing. People have learned that they can self-test for certain things. They might not have to actually go and see the doctor. So we believe what it needs is really a system that can deal with all this data, because even the best doctors, usually, unless you have a very severe chronic disease, you would only go and see your GP maybe once or twice a year or something like that. So everything that happens to you regarding your health kind of happens in between, right? So our vision really is to create a personal operating system for health for each individual, where you will be able to manage your entire health from your smartphone or voice-controlled device in the very near future, where all these different data points, even all the way to a full genome sequencing as kind of the baseline profile, and then one-off lab tests, sensor data, and symptoms, of course, that you report will all be computed against each other. And then once you have all this data, you know so much about the individual that you can really think about sort of predictive capabilities and thinking about preventing things before they even happen. You just mentioned that there are that you're a big believer in value-based healthcare, and I think once you have all these capabilities and you can make them available both to the patient and then as part of a multi-sided platform also to the next step health professional, then you can really create true value-based care and improve outcomes and reduce costs drastically. And that's what we're working on at ADA, and that's our ambition, is to go far beyond just symptom checking, but taking all these different sources of health information into account and making sense of them for the individual and then also for the caregiver.
Thank you. And over to you, Davide. I think from a pharmacy and GP perspective, you're coming, as you mentioned a bit earlier. Would be curious to see how do you see the digital component of this evolving, right? Bringing together your pharmacy know-how, the GP know-how that you have. What do you see as the kind of digital journey in terms of, the components we talked about in terms of access, care and diagnostic delivery, and how much of it can, will require people, right? Because that's what I think about as, I go to a pharmacy, I can talk to a professional or GP, and how much of it do you envision moving online or leveraging online in the future, I guess?
Yeah, so thanks for the question. So, first of all, in order for you to understand how digitalization is going to impact, say, the GP's world in Italy or the pharmacy world in Italy, I think it's important for you to start with some data points. So in Italy, we have approximately 23 million patients which suffer from chronic diseases. If you look at what's going to happen in 10 years' time, the number of people above 80 years old are going to be 5.2 million, representing 9% of the population. And another important data point is that 16 out of 21 million people which get access to the hospital during a year, they have either white or green codes, which means that basically they have minor health issues. And we're talking about basically that 87% of these 16 million, basically they translate in no hospitalization. So you understand why it's so important for the government, which has also been included in the the new recovery and resilience plan, to invest significantly in territorial health and in development of the territorial health. On the other side, as you know, in Italy we have some let's say budget issues, in the sense that clearly we need to cut healthcare expenditure. Historically has been cut, even if in the last few years that was not the case. And therefore, what happened is that we had structural issues in terms of the GPs. So GPs continue to decrease historically, and the number of inhabitants to GPs increased. As a result of this situation, we are very, very close to a situation where I think we can only be saved with an increasing adoption of technologies in order to save money for the government, and on the side, being able to provide the right services to the patients. How can we do that? Issue that we are faced, which is an additional issue, is that most of the GPs are very close to retirement. As you know, the GPs, they basically can practice until 17 years old. And so we are talking about that almost 50% of the GPs will retire in the next 2 years. So you understand this is another big constraint in digital penetration. Now, with all this in mind, we clearly need to consider all these elements in order to design the customer journey for our patients. And so in our view, that needs to start with the GP, and that's why we are working importantly along 4 dimensions, let me say. So the first dimension is facilitate the life of our patients in getting access to the services of the pharmacies, and also being able to, let's say, get the prescription directly on their smartphone, on their phone, and get the prescriptive drugs at home. There's been some relaxation in the regulation during the pandemic, which allowed for the electronic use of the prescription, and that in a way allows the use of the model that I just described. So meaning the doctor send the prescription to the patient, and the patient can automatically send the prescription to the pharmacy, and the pharmacy, upon authorization by the patient, can deliver the product at home. So this is clearly one avenue of growth for us, and that's something that we are focusing on at the moment in order to facilitate the life of our patient. The second point is on the management of the chronic patients. As I mentioned, we're talking about 23 million patients, so it's very important for us to start working on remotely managing the chronic patients, so that we are testing a few platforms on this front. The other point, which is in a way related to the previous one, is the adherence. There is clearly one of the important duty of the pharmacy is to make sure that there is a strict adherence to the health plan, which gets prepared by the doctor, and even on that we are testing a few technologies. And last but not least is bringing forward our health ecosystem view, which is fully consistent with the government view to create some, proximity healthcare provider. Let me put it this way. We call it all-in-one. So we're basically you basically come to us and you find what you need, from GPs to specialized doctors to pharmacies, and also collection point for blood analysis. And even on that front, the ability to book like an appointment with the GPs, the appointment with the specialized doctors, or the appointment with for the blood analysis, or also during the pandemic, we developed also an intelligent solution for the management of queues in the pharmacy as well in the GPs clinics. That is another area where we're going to invest significantly.
Klaus, may I comment about AI?
Yes, sure. Please.
Yeah.
Let's have a good discussion.
If we think about the GP world, how I see, of course, is the decision support that is very important. 70% of the calls or contacts can be taken care immediately, and just very few of them actually require any emergency room. And the ones with multiple chronic conditions, they are the ones who need to be contacted quite often, also physically. But the greatest promise to me from AI is actually from primary prevention. And what we're talking here all the time is how to treat different diseases and how to do the diagnostics. And actually, at least 40% of all deaths could be prevented. And what we actually do is pretty simple. You take care of the nutrition, no smoking, no alcohol, and avoid obesity. How do you support that? AI. But you should find the right persons. Who are the ones at risk? And that's where, with the large data lake, you can use AI to identify those patients. At the moment, in Europe, we use 3% of all healthcare spending on primary prevention. And still, it's 40 to 50% of the deaths that could be avoided. So to identify the ones who are at high risk to develop certain condition, and then to contact them by professionals, and then to make certain that, for example, the risk factors, they are in balance, and if not, you need to modify a little bit maybe the medication, for example, antihypertensive or cholesterol medication. So that's the way how we get most out from our activities on a daily basis and in a GP world. And that's where so actually we have that tool already in use, and it's actually pretty practical for both the physician and also for the nurses too. And actually physicians need nurses' help to identify or to contact the ones and make the further treatment recommendations.
And do you have an app that encourages like healthy behavior as well, or not yet from Terveystalo officially?
No, I think it's important that you have then the channel how to contact then the customer. You have identified that it has risk, and it's then when the customer is having the app, so you can send a message to the customer that please make an appointment, or can you come on that day?
Yeah, yeah. I think Daniel was the one who mentioned value-based care a little bit earlier, right? I think it'll be interesting because you can see these initiatives now globally of several insurance companies that are already trying to incentivize people to behave in a healthy manner. So when you work out, or log some steps with a Fitbit or an Apple Watch, you would get incentive points from the insurance company, and they try to basically modify your behavior, right, a bit. I guess I'm just looking a little bit at the time. So firstly, my question is, do we have until 3:30 or do I have 6 minutes? Because my display says 6 minutes and the program says 3:30.
6 minutes.
It's all right.
All right. Well, if we do have 6 minutes, then maybe just let's come to a little bit to the final question, which I had logged in terms of the ecosystem. So I think one of the key things, and Davide mentioned this as well, is the customer experience. And we see this in a lot of different industries where typically if you manage to provide a superior customer experience, you will get more customers. And that also relatively quickly, because in the digital world, people can compare different apps, they can compare different services. And I guess to the patient, it doesn't really matter whether behind the scenes it's only partnership or whether everything is integrated, as long as it appears integrated from the patient side. So I guess my question to all of you, and then we can go, in the same order, is how do you see your role in the ecosystem of the future? And with Terveystalo, you have such a position in Finland, maybe you don't need an ecosystem because you are the ecosystem, right? Because you're already combining so much. But with Affidea, I can see you being part of an ecosystem, maybe collaborating with a telemedicine pure play or other companies, for example. Or Daniel already mentioned a bit earlier how they're collaborating with organizations in the US, insurance companies. And Davide talked about the customer journey. So maybe let's start with you. How do you see this future of integrated care and integrated, Affidea diagnostics in this digital healthcare space?
Yeah, we collaborate, and we're keen to collaborate, of course, with the software developer of AI. I repeat, see AI as a loyalty factor. What is important is to see how you get an extra, who pays for that cost. So if you have an AI provider, he wants to be paid for in some sort of format per scan or per use of the application he developed, which makes you to be proven a better diagnostic company. So is that the patient available to pay an extra buck for having a provider with the AI, or the guy with no AI? Or is that the reimbursement by the state that is willing to give you a contribution because you solve massive macro problems like scarcity of radiology or imperfection of diagnosis, which then leads to second diagnosis. So we need to sort that problem out. And for the rest, again, this morning was spoken about patient being a customer. It is more likely to be because of the factors that are influencing the demand, the elderly population, and the access to healthcare becoming much more out of a personal decision than a consequence of an illness. People want to have preventive healthcare, want to be treated, and once you catch a patient, you want to catch the whole, the family and friends which are around it. So people come if you have the ecosystem which makes this experience as good as possible.
Great, thank you. Petri, does Terveystalo need ecosystem partners, or?
For sure, and probably under an umbrella of remote monitoring of patients and customers, and within that we collaborate with them, and there are some major areas that we've recognized to do efficient primary prevention also, and that includes sleep and nutrition and exercise, and of course then customers can monitor themselves, and then how to get that integrated to our system. And usually it's more a problem that there's more data that can be handled, that how to make that or sort it out in a way that it's actually useful for the professional then, that can be used to help to make the decisions. And that's what we, of course, want to continue, those kind of remote measurements. Some of the examples were already mentioned here, like blood glucose measurement and so on. But there's a lot to do how to get something useful out then for the one primary physician meeting a patient in a room. And of course, it's nice to get metrics out from there, but really that it's helpful and make some added value also for the single customer. And yeah, so that's probably.
Thank you. So I'm just getting these signals to speed up. So maybe Daniel, a final word around ecosystems. You mentioned ADA as the operating system of the modern healthcare era, and an operating system obviously then, you know, is often a platform, right, for others to join in. How do you see that developing?
Yes, so that's how we view ourselves as a platform. We would like to eventually reach 1 billion people worldwide in the next few years and collaborate with all kinds of stakeholders in the ecosystem as well, health systems and so on.
Great, thank you. So Davide, you've got 50 seconds. Quick final word from you around ecosystems. How do you see those developing?
So let me say, we do see ourselves as the proximity healthcare infrastructure. We have an advantage thanks to the regulation that we have in Italy. So the fact that we have a sort of monopoly of prescription drugs in a specific area, so that generate traffics. And as you know, usually there is a correlation between the consumption of drugs and the need of healthcare services. So I think we have the possibility to select the partners to really build a long-term ecosystem which create value for our patients and for our customers.
Fantastic. Thank you very much. So we've managed to hit the 3-second mark. Thank you very much for attending. Hopefully it was interesting in some aspects. And thank you very much.
Thank you.
Thank you.
Thank you all.
Thank you.